So there is a definite connection between sleep and your general health. There are some major medical problems that can happen if you have sleep problems. It could be a lot of sleep, it could be less sleep. So hyposomnia and hypersomnia, they both correlate with the general medical health problems. Number one in the list right now here is the short sleep. If you sleep less than 5.5 hours a day and that's your average, there is a huge chance you may get diabetes. Type 2 diabetes has a 3 times more risk if you sleep less than 5.5 hours a day as your average. 17% of the diabetic incidence is found out in severe OSA, obstructive sleep apnea patients who have it for more than 13 years of OSA. They end up with diabetes as 17% of the times. So that's a huge connection. The third big connection is OSA patients, they have a 50% correlation. So 50% of hypertensives have OSA and vice versa. The ideal sleep duration, I have more videos on these topics, so please check out my playlist and my channel on that. But the ideal sweet spot for the amount of sleep or the duration of sleep that you should aim for is 7.7 hours of sleep. If you want to avoid hypertension, if you want to avoid OSA issues, if you want to avoid the diabetes and so on and so forth. And then there is another problem. The neurodegenerative diseases are more common in patients who have OSA, which is one of the biggest sleep disorders. And the big problem amongst that neurodegenerative diseases is 40% of those have MS, multiple sclerosis, and surprisingly, that kind of MS with the sleep disorder correlation is more in men compared to women, and 60% correlation is Parkinsonism and 90% Alzheimer. So OSA has a lot to do, the obstructive sleep apnea, OSA, obstructive sleep apnea, has a lot to do with neurodegenerative diseases. And top of the list is Alzheimer, then comes Parkinson's, and then comes MS. So know about it, talk to your primary doctor, talk to your neurologist, because